Hi, everybody, and we're back here again on another conversation, conscious conversation with Dr. Nupur Agarwal. For those of you that are attending here for the first time, I just want to give you a quick introduction and then also talk about a little bit about my experience. And then I have a series of questions which I want to ask Dr. Nupur in today's session, which is the healing power of hypnosis. And if you have questions, please feel free to text them in the chat, or you can even unmute your mic later at the end when we open up for Q&A. Hopefully, we should be here for 30 minutes, 1 hour, and then we'll wrap it up just before 10. Great. So for those of you that have not met Dr. Nupur before, she is a medical doctor, and she's transitioned from being a medical doctor into the field of mind-body medicine. She's been practicing this for several years now, and she specializes in mind-body modalities like mindfulness, medical hypnotherapy, EFT, and others as well. And these have helped many of our patients, people who have cancer, who have got cancer, and other chronic health conditions. And I am one of those people that had a problem that I went to Dr. Nupur and saw a lot of benefits happening for me with this particular one, hypnosis. So I have also done her EFT workshops. I've been connected with her like as a therapist. She's been helping me since Jan 2022. And some of them results I will talk about shortly. She has also conducted a research pilot at a London hospital on clinical hypnosis and presented her paper at an international conference in the UK as well. To talk about my problem, I had an allergy problem which I was diagnosed with in June of 2021, which is a little over a year now. And I was struggling with it because I had to have one of these allergy medicines, Allegra 120, for about, I was normally at one a day. Sometimes if it would go bad, I would have 2 tablets a day. I know sometimes non-veg would aggravate it, so I would have to have two medicines. So I just had a problem with, how do I get rid of this? And when I spoke to Dr. Nupur, she said, we don't have to necessarily attack the allergy, but we'll do some release work to see what comes out of it. And she used hypnosis as a method to start with. And the release work was good because after we started with the release work, I began to become more organized, feeling better. And so it started off with those small differences in my body. I got into a bit of an exercise regime. I was able to control myself on food, just binging every now and then. And one of the release work that we did was quite big because it I I actually got a fever, cold cough. I was worried whether I was going to have COVID or whatever, but apparently it was just the release work, that the cord cutting session. And primarily after that, things started to go better. But in the sense, the medicine that I was happening, we went to a smaller dosage. And then from the smaller dosage, we went to the gaps between having one tablet a day started to go up and so on and so forth. But anyway, enough about me. I want to get in today's topic. So I have a bunch of questions. As I said again, please ask your questions in the chat box, or at the end, we'll take your questions by unmuting your mic. So, Dr. Nupur, thank you again for doing these conversations with us. And would like to start with, if you could explain what is hypnosis for those who are absolutely new to this concept.
Yeah, hi. Thank you, Rishi. So hypnosis is a very focused state of attention. It's when our attention is so focused on a particular aspect or on a thing that everything else kind of in the periphery dulls down. It almost kind of zones out. So it's a very natural state actually that we dip into very often during our day. It's like when you are reading something that is very, very absorbing. If you're watching a movie or a series on the television, and you are so absorbed in it that you kind of become that. You are feeling the emotions. You are thinking and feeling the way that your actors and characters are in that, and you're really moved. Sometimes when we are doing something we love, like a painting or a piece of music, we're practicing that. You could be having people next to you asking you questions, but you're so absorbed in that state of focused attention that everything else kind of dulls out. You're not even though your listening abilities are good, you're not able to register that. It somehow just overshoots you. So it's like a very, very focused state of attention that we all dip in and out of multiple times during the day. It's just that sometimes we don't know about it. And in a clinical setup, this is something we induce with the help of a doctor, a clinician, or a therapist, who then guides you into that state for a therapeutic purpose. Whether it could be, and we'll discuss that, multiple reasons why we would do that, but it's a very natural state of focused attention.
Great. So how did you get into this? I mean, you were a doctor. This is not part of your, as studying medicine in college and your practice. Is this something that is talked about, or this is not part of the medical?
Well, not a part of the undergrad course for sure. It's taught as a module in a lot of people who are doing psychiatry as their specialization. Some of them may learn that. I'm not sure if it's taught in all the universities, but I know of universities in the West that definitely do touch upon hypnosis as one of the modalities. How I got into the space was I happened to come across, as a very young doctor, I had just finished my internship. I was a junior resident. I had come across a book by Dr. Brian Weiss. And this is the book that talks about a patient of his. And the name of the book is Many Lives, Many Masters. And even though this talks about past life regression, but he does talk about using hypnosis as a tool in his clinical setting to help a patient with severe anxiety and other associated disorders. And around that time, I had also experienced in one of my postings where a patient talked about their NDE while they were under treatment. And NDEs are near-death experiences. So these things were happening kind of very spontaneously. The synchronicities were happening in the same year. And then I was led to the book. And I kind of understood that there is a science called hypnosis, which is used extensively by a lot of doctors in the West, especially psychiatrists and psychotherapists. And I actually then trained in a modality in India before I trained in medical hypnotherapy in the UK. So that's how my interest got ignited in this. And I realized before I got to know about stage hypnosis, which I'm going to talk about, I actually got to know about clinical hypnosis. So I'm glad that my perceptions were not colored by the gimmickry of this, and the bad press that hypnosis has. And that's what I'm actually here to break a lot of myths today about that.
Cool. So why is it popular, or if it's not popular, why is it not so popular? Why is it not known so much?
So exactly because hypnosis was considered to be a way of people thought there was a misconception that it's a way of controlling your mind. People thought they would lose control, and nobody likes to really lose control. So that was a misconception that people have had. Also, stage hypnosis kind of brought in a lot of misconceptions about hypnosis. It presented it in a very gimmicky way, in a very comic way, and it's almost like people think that they could be made to cluck like chickens, or be turning around in their heads and walk like sleepwalk. So there was a lot of unfortunately a lot of bad press came about because of these kind of stage shows that started to happen. And that's where the actual therapeutic aspect of hypnosis was lost. And one of the biggest fears and misconceptions that people will lose control, and that somebody else is in charge, and people would ask for your deep, dark secrets, or they would know your passwords to your bank accounts. And there was, I've been working in this space for 7 years now in a clinical setup. So I have come across, way funnier questions in that. So that's exactly why it has a bad press. And yes, it's a modality that is a little more known in the Western world and little less in India, especially. So, that's my intention to talk about the clinical applications and the power hypnosis can have along with the conventional medical and surgical modalities.
But in the sense, there are many people who put up these shows on how we can hypnotize you and make you do stuff. And actually, I've attended some of those shows. In fact, my friend, it was a live show. I was on stage. There was this doctor from Pune. I don't remember his name. It was done in Hindi, and and so he gave this kind of thing like, come and you'll make a lot of money if you come. So he went. I said, let me watch it. And the kind of stuff they made them do is like mind blowing. I mean, I was like, wow, how does this work? And then I asked him, look, because at the end, the doctor took 40 people and hypnotized all of them on stage. I think 2 or 3 were not getting hypnotized. So he said, no, it's okay. Tap them 3 times on their foreheads. It's okay. Wapas jaiye, go back. And so there is the reality that people do these shows. And then he made them forget everything for 2 hours, whatever he made them do, the circus he made them do. And he did some phenomenal stuff, like make a guy sit on somebody and remove the chair, and that guy became like a plank of wood, like could not bend. I'm like, wow, that's physically really tough task to do. So I asked Mangesh, do you remember anything? And he said, no, I don't remember anything. I'm like, how did he make you just forget? So there is that reality. Can you just talk a little bit about what are they doing? They're just doing entertainment, or because this end goal.
So they are definitely showing the power of hypnosis, which is amazing, but it's being used for something which is recreational or comedy, or something which is more for a public audience. And this can be misconstrued as well. Though people can think that it is, but half of the world goes back thinking that this is something scary because they don't know what's going on. They feel threatened. They feel that there is a kind of supernatural powers that are coming in, and that's what they're taking over. Whereas when we are doing so, I'm sure he's a well-meaning doctor and he knows what he's doing. But what also needs to be communicated in these shows, and if it's done by somebody who's clinically trained, that's good. Though I don't advocate stage hypnotic shows at all. What is important is to convey the power the science has. This is a science. There are so many studies. It's a very authentic, researched science. It is being used in hospitals across the Western world now, at least, for various modalities, which I'll be coming to. Hypnosis actually has effect on our brain. The centers which are associated with certain areas, we are seeing with fMRI studies or functional magnetic resonance imaging studies. We are seeing certain centers are getting activated, certain centers are getting suppressed. Our ability to relate to our bodies is getting enhanced. The entire mind-body connection is getting enhanced. So there is so much that's going on, and these shows are not really talking about this as a science, but rather kind of taking this in a very, very light-hearted or in a very comic way. So that's my intention to say that, yes, it works, but there is a very intense therapeutic aspect of this science that we must all be aware of, because it is impacting our brain functioning, our body physiology, and our perceptions. It is used actually for things like cancer. I've been working for 5 years in cancer care in a hospital. I was working with head and neck cancer patients. I was working with blood cancer patients and many others. So we were working with pain management. It is a therapy that is extensively, very powerfully used with pain management. It helps you to manage your pain. It is used to manage your side effects of surgery, chemotherapy, radiation therapy. It is helpful to manage phobias. I've worked with so many phobia patients, with so many addiction patients. So this has a very sound scientific basis, and that's what we must understand. It's considered to be a complementary therapy. The word we use is a complementary because it complements the medical and the surgical space. It could be called an alternative therapy also. But to understand that nobody is saying don't seek help from the medical or a surgical specialist, but along with that include this, because it will really enhance the quality of your life. And that's what my research pilot was, enhancing the quality of life for surgical head and neck cancer patients, you know, and understanding, it was also, I presented a poster on a needle phobic lady who couldn't take who refused bone marrow biopsy because she was so fearful of the needles that it could actually mean that she would have to stop her treatment because she was on a specialist drug trial. So, you know, this has a very profound impact on people's life, only if you understand what it is all about.
So that means whether it is somebody has a phobia of swallowing tablets, or, you know, like my aunt, she doesn't take tablets because she's got this phobia. She prefers an injection because that she can take. Like this,
Okay.
if it gets stuck, you know, I'll get stuck. So she can't, if she's in close to 80 now, and she can't take tablets. Would it work for her to be able to get rid of that
Absolutely,
phobia?
absolutely. Because when we are in a fight, so when we are in a stressful situation, when we have a trauma, so hypnosis works really well for even trauma, post-traumatic stress disorders, or PTSD as they're called. Sometimes when we are going through a stressful state in life, our response, which is called the sympathetic response, is a fight, flight, or freeze response. We tend to flee, fight, or get frozen with fear. A lot of times patients are that I have worked with, or clients, and even maybe your aunt, must have had a traumatic association with the pill swallowing. In fact, it reminds me of one of my patients who was during her head and neck cancer journey. They were, you know, you're made to wear these masks which are for targeted radiation therapy, and she got very claustrophobic to the extent that when she was released, she started vomiting even on water when the mask was removed. And she developed a phobia of water. So she could not drink water. She could drink flavored water somehow, if you could put some flavoring agents in that, or in form of a fruit juice, but the raw, normal water she could not. And trust me, it was just because she was frozen in fear and she had developed this deep phobia. It just took us 3 sessions. And by the 3rd session in the clinic itself, she was actually sipping water with me after maybe 1.5 years.
Wow.
So, you know, it's almost like the body system gets, the fear gets frozen, and the trauma gets registered. And then the patient is not able to, the person is not able to move beyond that. So by hypnosis, we use something called the power of suggestion. You know, we speak to the body's intelligence, that intelligence of the body that keeps our heart beating when we are sleeping, our breath moving. So we have a way in which we are putting suggestions in the body. And we also have many other modalities like dissociations, creating dissociative scenarios for patients, that you could be on a chair where you're getting the treatment done, but you're actually in a different place. So it's almost like daydreaming, mental imagery, power of visualization. So we call dissociative states. Those can be brought about in hypnosis. You know, there are incidents where people have undergone surgeries under hypnosis. So there is so much that we can do. And coming to your aunt's case, absolutely, yes. You know, once we can guide her through that releasing of her, whatever was the initial cause, or just to change her way her mind is perceiving it, it can help her to start swallowing the tablets again.
Okay, and in the case of, you said pain management, right? So now in the case of pain management, are we looking at, you know, this is like you won't need morphine, for example. You have worked on cases where they've done cancer, and if the pain gets too much, they might have to have some sort of a pain killer type of thing. Can
Yes,
the
in
pain
fact,
management be taken to such an extent where they won't feel the pain altogether?
So in fact, that's a brilliant question. In the Western world, Rishi, we have something which we call the opioid crisis. People get addicted to pain medication, and that itself has different repercussions and impact on the well-being. So what happens is, through pain management, we are able to bring down the dependency on the pain medication. We are able to help patients, and there have been studies that have been done in which they could see that the dosage and the dependence on the medication came down drastically, and it was maintained, right? And that's, even in my work, that's what I've seen, that we could bring down, and the ability to manage and cope with pain also enhanced. Now, there's a very important thing I want to mention at this point here is, that pain is a way of bodies communicating with us that something is wrong, something needs to be taken care of, right? And pain also has an emotional and a psychological component, right? So pain is physiological, but also a lot of emotional and psychological component. So pain should never be brought down to zero. And even if somebody's claiming to do that, I would say be a little wary of such claims, because it's almost like making a child that wants to express go dumb, go completely mute. So the body needs to express, and pain is a way of expression. So, it's very important for us to understand that if there is pain, that means there is something underlying going on, and we need to address that. So there are many nuances that we need to take care of in this situation.
That's an interesting one. I never thought of that. I'm going to shift slightly gears. Also, when I hear hypnosis and all, there's always this talk about past regression, past life regression. Now, I don't know if there are multiple lives or not. How does how do you explain past life regression? What exactly? That means you don't know for a fact if after you die you're going to go, or you know that for a fact that you're going to go into some other body and you can
Well,
it's like
that's a very subjective interpretation, and we all have our own beliefs, and we come from different backgrounds of faith. Some of us believe that past lives exist, some of us believe it doesn't exist. A very common misconception amongst public, and I'm talking about really well-read people as well, is that hypnosis equals past life regression.
ah,
And I want us to create this awareness today that hypnosis is a tool, and it can be used for something like past life regression, but that is like one of the many applications of hypnosis. As I talked about, pain management can be used for pain management. It can be used for phobia management, addiction management, weight loss, irritable bowel syndromes. And these are all clinical spaces in which I have personally worked and got great results. And my colleagues continue to work in the US and the UK, in this space. If we are talking about past life regression, yes, as I talked about, it is now documented. It's no longer considered airy-fairy or something that, is hallucinogenic. We have documented cases of people accessing their past lives, which then people were investigated, and those things they talked about actually existed. So there are documented cases of past life regression. The book that I talked about, which inspired me many, many years ago, was actually a psychiatrist's case study. A psychiatrist called Dr. Brian Weiss. It was his case, Catherine, that he documented, and you can read about the entire case history, the case study of Catherine. What is more important for us to understand is, as when I did medical course in medical hypnotherapy in London, it was irrespective of whether we believe in past lives or not. If a patient is in a state where he or she is able to narrate an incident which has a correlation with a problem or a challenge in this life or in this present moment. Say, for example, we what we call idiopathic conditions. A lot of times, these are conditions which medical doctors and surgeons say that they don't have a reason, but the patient is experiencing that symptom. It could be pain, it could be any other symptom, but there is no medical cause. Then it's not being able to be diagnosed and linked to underlying pathology. It's called idiopathic. Now, at that point, what happens is, a lot of times I used to get early on in my career, people coming to hypnosis as a last resort, that, nothing else is working. Can we try this? Because I've heard somebody say that it will. Some of them actually we have found that they were related to certain traumas of their past. And it could be a past incident when they were very young, or it could be an incident in a past life. They actually could see some associations, creating that pain, discomfort, especially, a lot of asthma patients have had a history or have had a connection when they died in gas chambers during Holocaust, or they died with suffocation or drowning in plane crashes. And in fact, I've personally had one person who had asthma, and they had an association of an image of another time when they were suffocated to death. Now, I don't question whether it was real or imagined. My point is, if a person's subconscious is creating that, is showing them the path and is helping them to resolve the symptom, then that's what's most important. Symptomatic relief is more important. And and creating that well-being for that patient. In fact, when Dr. Brian Weiss talks about Catherine, she had no connect. She was not a believer in past lives. Her faith didn't even, she never thought about things like past lives, but she went into something like that. So I would say that as a clinician, as somebody who does this work, I am very open. And even the person who comes to me, I will never say that believe in this or not. My intention is therapeutic relief. If you're receiving therapeutic relief and you're doing well without it creating any kind of disturbance in your perception, then that's a good way of going forward with it.
Great. Okay, thank you. That was interesting. And I guess if somebody's problem is going away, how does it matter what the method was, right?
Yeah, as long as it's an ethically accepted method and
And
it
it's
is
safe, right?
researched.
Right.
Exactly. So then yes.
Okay. I have one more question, which I'm not sure whether you kind of answered, but this was more specific to what are the things you've done in terms of if you have any, what kind of applications you used hypnosis yourself? You've mentioned a little bit, but can you go into a little bit more detail on that?
Yes, absolutely. I would love to, because that actually also motivates people that, especially when you have chronic conditions like chronic pain, chronic fatigue syndrome, when you're going through cancer. And cancer creates not only an impact on the physical body, it has an impact on the body, whichever part of the body has cancer. But also the side effects, as I talked about, there are side effects of radiation, there are side effects of surgery, the side effects of medicine. There are also emotional and mental impact that a person with cancer is going through. So I've worked very extensively in that space. One of my patients, actually, after radiotherapy, he had complete loss of saliva in the mouth. He completely went without saliva. Saliva stopped because the radiation does impact the salivary glands. So in fact, I remember that the dietitian had written a note saying that even the silogogues he's struggling with, and silogogues are artificial saliva substitute. We started working on this patient and started doing sessions with him. I would say after the third or the fourth session, the salivary production in his mouth significantly increased to the point that he started chewing and swallowing. Because if we don't have saliva, is what causes our mouth to be moist. And it actually plays a huge role in our ability to swallow.
Right.
Otherwise things get stuck in the mouth.
Right.
So his ability to eat and swallow went up. And in fact, then the dietitian said that they measured the salivary production and they said there was a significant increase in saliva production for this patient. So, there are so many things, because what happens is we start by kind of communicating with the body's intelligence, by the body's, the autonomic nervous system that is creating our physiological responses, saliva production, gastric juices production, people who have acidity, people who have irritable bowel syndrome. A lot of times there is a burden of stress and emotional disturbances to their physiology. In fact, I would even go to the extent to say that a lot of our diseases are created because of our mental and emotional stress. So, these components of our chronic health challenges can be taken care of through hypnosis very beautifully. I have worked with claustrophobia very, very deeply. I've worked with addictions, especially tobacco addiction, gaming addictions, as well as very interestingly, working on somebody with gambling addiction. So addictions, again, it's anytime you feel that consciously you want to do something, but you're not able to do it. Like consciously, a person who is smoking 3 packs of a cigarette a day, she knows that it's not something that they should be doing, but they're not able to do that. So that's where we enter the subconscious space. That's the space where we actually start putting the suggestions and start creating, situations. Also, I have worked with children. Children are naturally in a state of hypnosis. Till the first 7 to 8 years, they're so absorbed that, a child, you could be screaming at the top of their head. They don't listen. They don't register because they're so absorbed in what they're doing. So children are in a very, very receptive state. So I've worked with children with bedwetting. I have worked with children with severe anxieties. I've worked with children with skin allergies. So children are very good because also they are not consciously manipulative. They're not. They don't. They're very easy to let go of their conscious control. So children, again, are some places, and I'm sure I've forgotten a few more things that I've worked with. But yeah, this was a kind of a quick gist that came to my mind.
Right. So would that mean that as people get older, the lower the impact hypnosis will have on them, or it'll take more time for hypnosis to work on them?
That's a brilliant question, Rishi. In fact, we do a lot of my colleagues talk about hypnotizability and hypnotizability scales. Yes, some of us are more hypnotizable than others. Some of us are less. We are trying to bypass our conscious, critical, evaluating mind when we are getting into hypnosis state. So if we are, having said that, a lot of people who are, for the sake of semantics, we say left brain is logic oriented and right brain is creative oriented. But yes, somebody who is very, very control oriented, they are very critical, they're very analytical, and they have an inherent belief that hypnosis doesn't work. And I am not the person who can be hypnotized. I would perhaps do something which we call a hypnotizability test to assess them, to check whether they are hypnotizable or not. And we do have something like that in a clinical setup, which we assess the person for. And in my experience, I would say everybody can be, because we are trying to relax an individual and take them into a different state. Most people are very conducive, but in some people, it may take a little longer. Some people may not be as, like I've also had people who said that, no matter what I do, no matter what, I am not able to relax. So for those kind of people, it might take a little longer. But I would say 8 out of 10 people would definitely get benefits.
Right. In fact, this was one of the things that I saw in the show. This guy took 4 women. One was like in their teens, one was in their 20s, one was in their 40s, and one was in their 60s. And he just made them put their hand out and say, "Aapka haath paas aa raha hai, paas aa raha hai, paas aa raha hai, paas aa raha hai." He says, "Don't try and do it manually. Don't do it. But if it is moving, let it go. Let it touch them if it has to." And he did this, and he just kept repeating. And the teenager was like very fast. Within about 15 or 20 seconds, she kind of touched her hands. And the older one and the oldest, it's like literally the oldest one took the long. It came, but it took like almost 3 to 4 minutes before her hands finally touched. And then he says, "Did you guys move your hands close together?" And they said, "No, we didn't. It was automatically moved." He said, "No, I'm telling you, I told you that's why your hand was moving close. It was because of the repeated instructions that it went through." And of course,
focus state. Yes, exactly. He created a state. So, a very important thing is repo. When you are believing a person, in fact, I would say that we are so much in hypnosis most of the times. When we are believing things, when we are believing narratives, when we are conditioned to believe a certain way, we are actually hypnotized by our society, by our upbringing, to believe certain truths.
Media.
And that becomes our reality. That becomes the gospel's truth, and we are ready to wage wars for that, because that's my point of view. That's my perspective. That's a focused state of attention and complete belief in that space. So it's something that we are always into. In fact, I joke with a lot of my patients and clients that I'm trying to de-hypnotize you, because you're so hypnotized by your diagnosis that I am a patient of this, that it becomes your identity. In many ways, we are trying to uncouple that and step and bring you out of that space.
Fantastic. Okay, one more question. I think some people, I remember when I went for a hypnosis session with somebody, I was like more, let's see, ye kya hai? Let's go and experiment kind of thing. I saw a show, and this one is doing therapy. And this was in Bombay. I had gone to somebody way back in 2010, I think it was 10 or 11. And I told about my experience to one of my friends, and he said, "Acha, aisa hua kya? This is what happened to you? Okay, then I don't mind, but you be there with me." So there's always this anxious, like, so is it safe? So what would be your responsibility in terms of, has there been any situation where you've done hypnosis and things have gone, oh crap, what happened? He's gone and stuck in some hypnotic.
Yeah, that's a brilliant question. Absolutely not. Absolutely not. It's a very, very safe modality, but done by somebody who's qualified. So I would say that somebody who has a very sound medical, clinical, psychological training, nursing training, those people who are from this kind of, specialized state, a specialized educational background, that's where I would say, please go and get hypnosis done. I know a lot of courses which are there, which have sprung up over the years, but I would be a little critical about them, because I feel that because I have a medical background, I've been trained in that space, or somebody who's got a psychological background, psychiatry, and even nursing, these are very safe dentistry. They're very safe, medical background, where you have knowledge of what the person is doing to you. They have their ethical boundaries. We believe there are some protocols that we adhere to. There are certain client patient confidentiality and a lot of other things of how do we maneuver through different for all if somebody's come with a pain and you just go to somebody who's not that thoroughly trained, they would just try and work without understanding that there could be an underlying medical condition that also needs to be addressed simultaneously. We don't want to we have to take care of that aspect very strongly. We never say go off any medication. We say that we will start doing this and we may taper down depending on in consent with your clinician. So, it has to be in a very, very at the hands of somebody who's really skilled, trained and qualified. So that's number one thing. And number two, second thing is that all of us have a sense of we our own subconscious mind will never let something to be done to us which is not ethical. You will just have, there'll be a barrier that will come up, because this is a very gentle therapy. You are guided into a state of hypnosis where you're being given suggestions, or you're being asked to do some things. Now, if it is coming from some unethical space, your subconscious will not go for that. You will not. There is a very, very inherently, it's like almost if you're in a crowded space, something as simple as that, and somebody's staring at you, I can bet on you that you will look up and you will exactly look at that person. This is our subconscious energy field. If you're traveling, try that. You will be amazed that, oh, you're reading a book, but all of a sudden you look up and somebody's staring at you, because we have these mechanisms in our brain. Is such a powerful organ. It doesn't come with a manual, unfortunately, but there is so much that is going on that we have that are self checks. So nobody can violate, nobody can trespass your own energy space as long as they're ethically trained. So I would say this is very important for us to go to somebody who's.
Okay. And what about, can one do hypnosis on oneself, or does one have to go and get a certification to, do a course?
Okay. Yeah. So self-hypnosis is typically something that you would be taught if you are seeing some specialist. So when I would be seeing my patients and my clients, I would always teach them self-hypnosis on the third session or some other session, having done some modalities with them, having made them experience it. Then I would teach them as a self-help tool. So everything that they're doing in the hospital, they're learning with the clinician or with their therapist, then they can use at home through self-hypnosis as a further reinforcement, as a tool to enhance their well-being. I remember when I was doing it for a patient going through cancer, and then they learned self-hypnosis, and then they had a dental appointment, after when they were going through remission. And then that person actually connected back and said that, I used this when I was going through my dental treatment, I had so much anxiety and stress, but I used this technique to take myself to a happy place. And I completely dissociated from what was going on here. And of course, they got the local anesthesia, but their levels of stress and anxiety did not exist at all at that level because they were so, upset about that treatment otherwise. So it's a very transferable skill. So once you learn self-hypnosis from somebody, I would say you don't need a certification course, but yes, it's a part of your therapy. It's a part of your journey, whatever you're seeking help for. If you want to just learn self-hypnosis, that can also happen. You can just approach somebody who will teach you self-hypnosis. It does take some time to understand that and learn that. And once learned, then it can be your self-help tool. People who are like, I have also worked with performance, people who are into performance athletes or public speaking. So, once you learn this technique, you can calm yourself down. You can give yourself affirmations, suggestions, and start creating positive visual scenarios. So imagery, visualization, there are a lot of aspects to it. Yes, you can definitely do it.
So would it be better to do self-hypnosis, or let's say in my case with you, you are my therapist, I'm going to you and you're helping me and all that stuff. And then I go into, can I get you to do a recording and then play it back and then go into a state where I just use your voice, which is already recorded, and do hypnosis again for the particular problem that I'm having? Or what is your...
So those are actually two different things. A lot of times we give that recording to clients and patients.
Is there something wrong with the mic? The voice has gone down a bit.
Is it better now?
Yes, now it is better.
Okay.
Yes, fine.
So yes, so we would definitely have a recorded session, but that is not self-hypnosis.
Okay.
Self-hypnosis is actually when you can guide yourself in a state of hypnosis and do it on your own. Like you're literally being your own therapist. So you're being taught how to take yourself in that deep, calm state of relaxation, what suggestions to give yourself, how to be very specific with your problem. So, you, for example, are doing it for weight loss, or you're doing it for allergy. How do you then give yourself auto-suggestions in a state of self-hypnosis? So yes, self-hypnosis is very different. It's a different technique that you learn. Right. It's not a recording that you will receive. A recording would be of a session that you would just plug in. But self-hypnosis is something that you will learn.
Okay. I got a couple more questions, and I know I'm running out a little bit on time because I'm sure there might be questions from the audience as well. One of the questions that I have is, so there are two more questions. I don't know which one I should take right now. Okay, let's just start with what kind of people facing what kind of problems should approach this as, like you mentioned a few, but is there a bigger list of people? One you said was pain management. Can you give
management, all kinds of, in fact, any symptom that you are experiencing in the body, which has been chronic. It could be fatigue, it could be, any kind of claustrophobia, asthma, it could be menopause related, hot flushes, it could be intense itching, it could be stress, anxiety, it could be phobia of, public speaking, it could be fear of heights, it could be fear of flying. A lot of people I work with have that fear of flights. They don't want to, take planes, so they, in fact, don't want to go on business trips. They want to delay, excuse, and not. So any kind of those spaces. Gut issues, irritable bowel. In fact, there was a study that was done where they noticed that in hypnosis, the gastric juice production could be altered to a great extent. It could be enhanced or it could be reduced as well. So, people who are going through gastric challenges, irritable bowel, as I said. And people who are generally having a lot of fear, very fearful, or challenges with relationships as well. Sometimes when we have traumatic experiences and we are stuck, whether it's sexual abuse or whether it is a traumatic accident you've had or a passing away of a loved one, a lot of things come under the term PTSD. It is not just with people who have had war challenges. PTSD could be a child who was mocked by a teacher standing in front of the whole class saying that you didn't do well, and he or she kind of registered that could be a trauma for them. So, anybody who has had traumatic experiences in the childhood. So a lot of things can be helped through hypnosis.
You also mentioned addiction. So alcohol addiction, drug addiction, smoking, all this can be treated with hypnosis?
Yes, to a great extent, it can be done through hypnosis.
So even weight loss, for example, can be done through hypnosis?
Oh, yes, absolutely. In fact, and even hypnobirthing, before I forget, in the Western world, in fact, in UK, we have an entire, hypnobirthing is being practiced a lot to help people. I have personally worked with a couple of my clients who had challenges with birth, and hypnobirthing is again a big space in the West that helps. You asked me specifically about addictions, Rishi. Did you ask me that?
Yes,
Yeah.
yes.
So addictions, yes, absolutely. You can definitely help with a lot of addictions because again, to a great extent, addictions can also start from a very, time of life when you were very stressed, very anxious, or you've had a loss. And then giving suggestions to the mind. We have multiple techniques, where we start to change the mind and the body's association with addictive substance. It could be aversion therapy, it could be future pacing, it could be other things, it could be giving suggestions to the person. So altering their relationship with the substance and then creating a kind of a drift from there.
So that means it's quite possible that here are two smokers, but the reason they got into smoking could be different. So therefore, is hypnosis trying to figure out what is the root cause of them becoming addicts, smoking addicts, and therefore the solution to both of them could be different because the reason they took on to smoking was different.
Yes. So sometimes we could go into the root cause and trigger and change that. And sometimes all that we need to do is help the patient to a person to get over the habit. And both work. And sometimes, we sometimes we don't. Sometimes root cause recognition really helps the person, but with addictions, it's more about getting over the habit of the addiction. So how do you break the neural pathways of habit that have created that loop, and changing it through the subconscious work. I have worked with people who have told me, I don't want to quit, I want to reduce. And they're so clear about their goal that they will actually end up reducing, not quitting. But somebody who believes that for me, reduction doesn't work, it's all or none. And they're very keen. Now, one thing that I have seen, and there's some truth to it as well in my practice, is that hypnosis works for people who really want it to work for them. I have had people saying that, please, can you help my partner? I want he or she to quit. It doesn't work. The person needs to be motivated. So if it's you going through cancer treatment, you need to have some level of confidence that I want to thrive. I just don't want to survive. I want to not to be a victim to my diagnosis. So somewhere, even if I have a window of open, like 1%, 2% openness in an individual, I can further help them to widen and be more open and help them. But if somebody is really closed and really, in a state of nothing can help me, I am gone, I don't want to quit, I'm happy being an addict, I'm happy, though, that's their perception. But then that nobody can make them go through this. They have to be motivated to do that to some extent, at least.
Right. Okay, one last question before then we'll take it. We'll see if there's time to take questions from the audience. Can people learn hypnosis through an online course or a pre-recorded course or a workshop online, or does it have to be like face-to-face, live in front of a teacher? And
So I would say if you want to do sessions, then you can definitely do it online. Like I do sessions now on Zoom all over the world. I have clients and I'm working online on Zoom to help people with various challenges, like I mentioned. But if you want to learn to be a hypnotherapist, then you need to definitely go and attend a proper course. Like for me, it was a proper 1-year medical hypnotherapy course because I had a background of training. Otherwise, it can be longer. I would never advocate online courses to learn to
MES.
become a hypnotherapist. Like a DIY kind of a course. No, I would not. If it is a reputed institute and if they have, because of pandemic, started offering courses online, that's different. But you need to have a real life experience and you need to have a background. You need to be a psychologist, psychotherapist, nurse, dentist, ideally somebody who has if you want to work in this space, some background, some very sound medical or psychological or allied healthcare professionals.
Great. Awesome. This has been a great session, but we're running short of time. We just have a couple more minutes to go. I just want to tell everybody who's been listening, if you have questions, you can type your questions in the chat. I will definitely read them out and ask Nupur to answer. And if you don't have questions, that's also fine. I will be, for those of you that are watching the recording, I will be posting the link of the WhatsApp group. And you can join this group and get updates of our next conscious conversation with Dr. Nupur Agarwal. And yeah, just don't promote your business or spam the group with any of your products or services. And the purpose of the group is to specifically ask Dr. Nupur Agarwal questions related to the things she is an expert on. Having said that,
There's a question, I
Manoj,
think I can
yes,
see.
Manoj has opened up his
Yeah,
video.
also, before I take up Mr. Manoj's question, there is a question by Mandar.
Oh, okay.
Can this help us to lower cortisol levels? Absolutely. Cortisol is a stress hormone. Again, it is released by when we are in a fight or flight or freeze response, which is the sympathetic response of our autonomic nervous system. And stress is what causes it. A little bit of cortisol is actually very good because it helps us to function. It's considered to be important. And even we have something called eustress. So I'm going very quickly because I know we are almost running out of time. But when the stress becomes chronic and when the cortisol levels are very high, and then we say that, these are lifestyle diseases, cardiovascular conditions, stroke, a lot of cortisol increase creates a lot of havoc in the body. Through hypnosis, we actually help you to get into a state of deep rest and relaxation. There is a sense of dissociation. And when you are doing that, you're automatically coming into a different space, which is the parasympathetic response, which we call the rest, digest, relax response. And from that state is where healing happens. And that state helps to reduce the cortisol levels in the body. So that's actually one of the key ways in which hypnosis can actually help us. Thank you for that question.
Yeah. And before we answer the next question on the chat, which I think is a good question, let's give Manoj an opportunity to ask a question.
Yes.
And then we'll take that chat as the last question because
Sure.
we are running out of time. But please join the group, guys. You can ask your questions on the group as well. Okay.
Yes. Mr. Manoj, please go ahead.
Yeah, it has been said that a person who's a weak-minded is been hypnotized very easily. Is it so?
Not at all. It has got nothing to, that's a brilliant question, sir. Thank you so much for asking that. It has nothing to do with weakness. In fact, it's not a personality trait. It's something that, as I said, is a natural phenomenon that we all experience. And that's what I started the talk with, and we are using this state for our therapeutic purpose, for a therapeutic alliance. We are trying to create a well-being. It has got nothing that, it's not a sign of weakness. In fact, in hypnosis, you get the control back because as I said, we succumb to our illnesses, we succumb to our life challenges, we feel powerless, we feel victimized. Through this modality, you are getting the control back in many ways because we are trying to dissociate you from the problem and see it from a different perspective. Otherwise we are so involved in it. So it's not at all like that. In fact, on the contrary.
Okay. Thank you.
Thank you for that question.
So we'll take one last question. It's there on the chat, so you can also read it, but I'll just read it out here. How can we, through hypnosis, change the thought of, I'm guessing, my lover when she engaged with her husband and she is not ready to even touch him? I'm guessing this is intimacy. So
yes,
can you?
Absolutely. Yeah. Thank you for that question. So, well, we need to understand what has created this aversion in an individual towards somebody who is, and them being in a relationship. It could be from a past abuse. It could be from an experience before their partner. It could be some kind of psychological sabotage that the person feels that if they become vulnerable, it's not safe to become vulnerable. They'll become weak if they are allowing and putting their guard down and becoming intimate with this individual. So through hypnosis, I can't tell you how it will happen, because for that you'll have to take a journey of 15 years of specialization like I have done. But I can tell you they can be helped either to get over this, or if it's an abusive relationship, to walk out of that. So, you know, sometimes you have to also understand whether it is right for the individual or not. So it is completely to empower a person to enjoy and feel and to live a life fully and to enjoy a relationship fully. So we have to definitely, we can definitely address this. In fact, we have used hypnosis, and it is used a lot with abuse and a lot of with intimacy issues as also. Thank you for that question.
All right, great. Thank you so much, everybody, for joining us today. I have a hard stop now. I have to stop this conversation, although it has been very interesting. I would like to keep going, but I have posted the link of the WhatsApp group. Somebody even asked me for my number. We can connect on WhatsApp itself, and you can join this group on WhatsApp and ask questions to Dr. Nupur directly. And for those of you that are watching the video recording on the YouTube channel, the link to the WhatsApp group will also be in the description below. Thank you very much.
Rishiji,
Yes.
I have attended all the session of Nupurji are so insightful. It's very, very, I tell you, many learning, very, very wonderful things.
Thank you, sir. Thank you so much. And thanks to all of you for being present here. And thank you, Rishi. It's always a pleasure. Thank you.
One word, sir. I
Yes.
have asked the last question, Mr. Ulahanan from Palgad, Kerala. So the answer is really wonderful.
Okay. Okay.
Thank you.
That was
Thank
for
you,
your
sir.
question. Okay. Okay.
Thank
All
Great.
right. Thank you. Thank you, sir. I'm glad it made, I was able to communicate it. I was a little quick because we were running short of time, but I'm glad it helped. Thank you so much.
Thank you, everybody. And we'll see you in the
Thank you.
next Conscious Conversations whenever it happens.
All
Bye-bye.
right. Bye-bye. Thank you.
Yeah.
Okay. Bye-bye.